Hello everyone, my name is Alois and I have been practicing massage therapy for over 20 years and I have been preparing students for the OSCE examination for over 15 years. I would be happy to share my experience with you by demonstrating the ideal procedure at each one of the 7 stations of the OSCE examination process. The OSCE examination process was meant to mimic an appointment where a therapist sees a client, they interview the client, then they assess the client, then they describe treatment plan, ask for consent to treat, then they treat the client, and after the treatment they give the client home care remedial exercises. Therefore, the exam doesn't only test your knowledge, but it is testing the interaction between the therapist and the client and the professionalism of the therapist. As you probably know, there are 7 stations of the OSCE examination that you have to go through. The first station, station number 1, is the remedial exercise station, where you are going to be given 3 different exercises to apply to the client for home care. You have to demonstrate these exercises, then you have to get the client to show these exercises back to the therapist, and of course you have to describe the purpose and the reason for doing these exercises. And the exercises must be appropriate for the muscles that are being chosen. The second station is the interview station. On the interview station you are going to be given a health history form, and then you will have to tell the client about the confidentiality of the process, the purpose of the interview, and then ask all the standard questions about the chief complaint and sometimes about the secondary complaint. The third station is assessment number 1. In the assessment number 1 station, you are going to be given several structures, musculoskeletal structures to palpate, and you are also going to be asked to perform several orthopedic or neurological tests. You have to palpate the structures using correct anatomical terminology and directional terms, and you also have to perform the tests correctly and explain what a positive sign is and which structure is being tested with each individual test. On station number 4, or the assessment 2 station, you are going to be given a case study in which the client has a chief complaint, usually a pain or numbness or discomfort in one of the chief areas of the body. You are expected to demonstrate appropriate assessment procedure, which usually includes ranges of motions, variety of special tests, neurological scanning, myotomes, dermatomes, and reflexes. And during the station, you also have to appropriately communicate with the client, in which you are giving them layman terms, directions, and advice. At the end of the assessment 2 station, you are expected to give the client appropriate clinical impression. On the next station, which is the treatment plan and consent station, you are going to be given a case study, and then you have to explain to the client the nature of the treatment, the benefit of the treatment, possible side effects, contraindications, and the nature of the treatment as well. Then you will ask for consent to treat and also explain to the client the future or the ongoing treatment plan. On the next station, which is the treatment station, you are going to be given a case study. When you enter the room, the client is going to be lying on the table in the appropriate position, and you are going to be performing a 10-minute treatment on the client's chief complaint area. You are expected to communicate with the client, and the client is going to be answering. You have to demonstrate a variety of techniques that are appropriate for the treatment of the condition. On the next station, which is the technique station, station number 7, you are going to be given 4 different techniques on different parts of the body. These techniques are usually ischemic compressions, joint mobilization, friction, and one of the Swedish massage techniques. You have to demonstrate these 4 techniques on the different part of the client or their body parts and communicate with the client properly.